We're going to talk a little bit about general surgery today, what it is, and what do terms like less invasive surgery or robotic surgery mean. Dr. Abhishek Gupta is a surgeon at Bronson General Surgery Specialists in Battle Creek. Dr. Gupta is a graduate of Texas College of Osteopathic Medicine and completed his residency at Michigan State University, and he's with us right now. Dr. Gupta, good morning.
Hi, Tim. Good morning. Thank you for the opportunity to talk again.
People hear that term general surgeon. What exactly is a general surgeon, and what type of surgery and procedures do general surgeons perform?
Well, that's a very good question, and that's actually what I really love about the field. It covers a lot of things head to toe, anything from skin cancers of the head and the face and lumps and bumps. Sometimes people get cysts on their tailbone. Sometimes we cover emergency surgeries. At our hospital, we cover the trauma surgery service. Sometimes we do emergency surgeries like when people have an infected appendix. We do a lot of hernia surgery, colon or intestinal surgery, even hemorrhoids. And there's even more beyond that, but that's what I like because the day can be really varied, and then that's a normal day for us, so covers a lot.
Do you specialize in any particular area of general surgery?
Yes, well, there's a few things that we do here that may be different from other places. We do a lot of endoscopy here, which is upper scopes for EGDs, and we also do colonoscopies here. I do a fair amount of minimally invasive and robotic surgery here at our hospital as well because we have those capabilities here.
So, how are you able to perform the same surgeries with such a much smaller incision than in the past and still have the same outcome?
It comes down to just advancement in the tools and the technology and just progressively just sort of refining your techniques. Before, we used to only have the option of making large incisions and doing surgery through these open incisions to get to where we needed to be and take care of the problem. And now we have, robotic surgery available to us as a type of minimally invasive option where we can do the same surgery through a few small incisions that are less than a half an inch. And you can take out someone's entire intestines just through a few small incisions now, and where people used to have to come a few days before the surgery, have their surgery, and then stay in the hospital for a week or more. Now things are often just outpatient surgeries where they just get a day and a time for the procedure and they go home right afterwards, or maybe they're only in the hospital for a day or two compared to a much longer period before. So it has a lot of advantages for sure.
Yeah, I remember growing up and my grandmother had gallbladder surgery and she was in the hospital for quite a long time and then was on the mend quite a long time after that. And I remember a coworker actually passing away and then all of a sudden came along these new techniques where you just make these small incisions and it really revolutionized it. And now you've taken it to the next level with robotics.
Yeah, certainly there's been a huge amount of change in the last 20, 30 years. And it's really nice for us, and it's very nice for the patients as well. And surgery is a big deal, no doubt, and we take that very seriously. And so we go over everything in a lot of detail beforehand. But in general, we're able to do these things now, and people tend to have less pain, and they get back to their normal activities much faster doing it this way now.
You mentioned appendectomies. Are those as common as they once were, or is it about the same?
I'd say it's a fairly common procedure that we do, and over the course of people's lifetime, just a certain percentage of the population will get it. Maybe about 1 in 8 people throughout their lives will have their appendix removed, and so usually it's not anything they did or caused it to happen, but it just happens sometimes, and usually we just do surgery pretty quickly and take care of it. So sometimes people are in the hospital for a couple of days. Sometimes they go home right after the surgery if it's not too bad.
Getting back to the robotic system, then, do you use that for all surgeries or only some?
Actually, yeah, we kind of, it's a tool again, and we just try to apply it where it makes sense. And as time goes on, we're trying to use it in more and more areas because, again, I think there's a lot of advantages, including less pain after the surgery and faster recoveries. So, for right now, we're doing a lot of hernia surgeries, and that's getting people back to work about a month faster for these groin hernias the way I do them, and a lot of other hernias around the belly button and the abdomen. It's usually an outpatient thing now where people just go home right after the surgery. And before, they used to have to stay in the hospital for a couple of days because they'd be in a lot of pain. And so we're also doing colon resections, meaning removing sections of the large intestine. And people now, they're in the hospital for that about a day or two afterwards, where they used to be in the hospital for maybe 5-7 days or more.
Boy, it's really great. Less pain, less hospitalization, so obviously a lot less cost.
If people are wanting to get back to work, and sometimes it's a little more work for me during the surgery to do it a certain way, but if someone wants to work and I can get them back to work a month sooner, then I'm all for it.
Excellent. Now, somebody has more questions about general surgery or robotic surgery at Bronson. What do you recommend?
They just search Bronson and my last name, G-U-P like Paul, T like Tom, A. That should pull up my website. I have office hours here, and I do surgery here at the hospital here in Battle Creek. And in the last several months, I've been going out to the hospital in Paw Paw, which is the Bronson Lakeview Hospital as well. So I'm getting more office hours and more time to do surgery. So it should be readily available to see people and answer any questions they have.
Dr. Abhishek Gupta, surgeon at Bronson General Surgery Specialists in Battle Creek. Thanks so much for your time today.
Well, I appreciate your time, Tim. Thank you very much.